there are not a lot of us that are excited usually about dentistry, especially if you're doing it over and over again. So when you find somebody with the same excitement and passion as you, it's like having kids in a toy store. They all just want to play and share these things with each other. So I think it's refreshing because, as I say, sometimes when you're in your office, you're just in your own wall space, four walls. The patient doesn't really get excited about seeing you in the first place. So it's nice to then have somebody like your colleagues to share the cases and ideas and even the after results with them. So yeah, it's very important. I always say the story how I became fascinated by this green fluorescent instrument I have never seen before. Typically in university we have these old grey instruments, but then I saw, oh look, there's a green one. And then I researched and I saw, wow, they have colours, and I understood that the colours were an identifiable solution to the assistant and also the dentist. So now if I say green, the nurse knows it's the fissura or whatever. So this is why I got into LMATE, and just being able to hold them in such a comfortable manner, using them quite easily. There's not too much pressure on the wrist or the fingers, especially with doing everyday stuff. Easy to clean as well with regards to assistance. So it's much easier to maintain as well, I think, yeah. Because I have been trained on the kit, the Style Italiano kit, I tend to use mainly the modella, condensa, fissura and posterior misura in my posterior work. And for anterior, I also use the condensa, the modella, and now the solo as well. I really got into using the solo, so I use that a lot these days, along with the posterior misura and the fissura. Yeah. So it's just predictability. If the instrument helps you become more predictable, you are then you're more positive about the workflow, and if you have an easier workflow, you have a more predictable outcome. So the better the instrument, so if they are sharp enough for removing excess, if they have the right shape for packing, if they have the right design to remove certain aspects of your restoration, this then makes your life a lot easier, and the patient's life as well, actually. So higher quality also means that you don't have to replace them as often as you would other instruments. So yeah, that's why. The fissura, this is my favorite instrument. As I said, historically, this is the instrument that introduced me to LMATE and Style Italiano, actually, and I was just so excited to see a color on an instrument. But what I really like is the pointy edge for designing the fissures, and also the other side for modeling the cusps. So this instrument converted me to everything else. Secondly, I love the misura for posteriors. This is because it allows me to control the marginal ridge height, and if you control the margin ridge height and get it very accurate, then you often don't spend much time doing any adjustments at the end. So this saves me a lot of time, and it makes my life predictable. And then finally, because as you can tell now, I do a lot of posterior work, especially following COVID again, cleaning and sterilization was a lot more in demand. So again, having my LMATE sets, running out of them, I needed something where I could have 5 or 6 or 7 that we could replace very quickly, and the solo posterior was invented, I guess, for that reason. So this allows me to have 4 or 5 instruments in one instrument. So So these are my top 3 instruments from Alamate.